All right. So our speaker tonight is Dr. Ibrahim Ayuba Sini. He is a public health officer in the Department of Public Health and Epidemiology for the Federal Ministry of Livestock Development. So I will go ahead to read his bio to usher in for the session properly. So Dr. Ibrahim Ayuba Sini is a distinguished fellow of the College of Veterinary Surgeons and a seasoned public health officer in the Department of Public Health and Epidemiology at the Federal Ministry of Livestock Development. He has played pivotal roles in disease control and emergency response. His notable appointments include serving as focal point for disease emergency preparedness and response between 2018 and 2023. Team lead for Avian Influenza control 2015 to 2022 to 2020, and team lead for the National Polio Control Strategy and Measles Initiative, underscoring his expertise in safeguarding animal and human health. Ladies and gentlemen, please help me welcome Dr. Ayuba Ibrahim Sini as he takes the stage to talk to us on how we can prevent further future zoonotic pandemic. Let's welcome him with claps, with celebration in the chat box. Thank you so much, Dr. Ayuba, for joining us. We are so happy having you on the pod. Please, the room is yours. Thank you.
Okay, so before I start this presentation, I would want to acknowledge the presence of my boss, representing the head of department, the person of Dr. Mairo Kachala, a deputy director, and again a focal point for Zoonosis with the Federal Ministry of Livestock Department, Department of Public Health and Epidemiology. Distinguished senior colleagues, I want to say good evening, and I want to start the presentation without wasting of time because I know we're behind time already, 10 minutes past 8. So the topic we are considering today is preventing future zoonotic diseases, zoonotic pandemics. And just for emphasis, I would want to put the differences between prevention and control clearly. In epidemiology or public health, when we say prevention, we are trying to stop the entry of any pathogen or disease-causing organism into a given geographical area. And prevention is different from control in the sense that prevention, you stop the pathogen from coming in, while prevention control, you are what? Stopping or preventing the spread of the pathogen outside. Some preventive measures are like vaccination and biosecurity. These are preventive measures, while control measures could be stamping out the containment and the rest. So that is just by the way. The learning objectives for this presentation are as follows. So at the end of this presentation, I'm hopeful that much awareness will be created on the importance of One Health approach for timely detection and response to disease outbreaks. I also wish that at the end of this presentation, I will be able to encourage a research initiative focused on zoonotic diseases to better understand the dynamics of zoonotic diseases and develop an effective control measures for zoonotic diseases. And also promote the implementation of One Health approach at all levels. And what I mean by at all level means both at the national, subnational, and the local government as well. So globally, Africa is considered potential hotspot for zoonotic emergence.
Yes,
Are you
sir.
with? Okay,
Yes.
yeah.
Yes.
Okay. So, like I said, I've already presented the learning objective for this presentation. So I was on this introduction slide, and I said that globally, Africa is considered potential hotspot for zoonotic emergence. And the reason is because of the high wildlife biodiversity. We have quite a number of game reserves across Africa. For example, we have a game reserve in Tanzania, in Botswana, in Uganda, and in Zimbabwe. And we have a huge collection of wildlife gathering there. And it's become a tourist attraction for a lot of tourists across the globe. Out of the 7.8 billion people living on Earth today, Africa accounts for 1.548 billion. And what that means is that the population in Africa is huge. And also, it's also very important to know that the growth rate of African population is about 2.25% annually. And with that kind of factor put together, there's a lot of pressure that is put on land use. And what that means in the epidemiological cycle is that there will be a lot of encroachment into the wildlife, bringing the humans and the animals into close contact. Zoonotic diseases like Ebola and COVID-19 represent a critical threat not only to global health security, but also to the economies of developing countries. You will agree with me that just after the outbreak, the pandemic of COVID-19, economics of countries all over the world, global economics, began to what? To nosedive. And up to now, the global impact of COVID-19 on our economy is still affecting us. So because of the weak surveillance and paucity of scientific data, it's very difficult to really quantify the burden of zoonotic disease in Africa. We have checked a lot of literatures, and the challenge has always been lack of surveillance data. Some literatures estimated 44% burden of disease, but all cannot be relied on because the surveillance system across almost all the African countries is very weak, and we cannot reliably depend on it to give us a true picture of the burden of disease. But again, we know that the burden of disease is quite high. Now, to set the ball rolling, I would like to just say something about zoonosis. Of course, being that all of us are vet or science, we have science base, we know zoonosis. Zoo means animal, and a German physician was the first to coin the word zoonosis, and his name is Rodents Virchow. Zoonoses are infectious diseases or pathogens that can be transmitted between animals and humans. Again, to add to this definition, here zoonoses also include antimicrobial resistance. If you look at the diagram on the left side, it shows how pathogen flow at the wildlife livestock human interface. We have the wildlife, we have the domestic animals, that's the livestock, and then we have also the humans. If you look at this diagram, you will notice that both ends of the arrows are what? Are pointing to each group of animals or humans. And what that means is that there are two types of pathogen flow or transfer happening here. We have animal to animal transfer, yes, and we also have animals to human transfer. And if you, by showing of this arrow, what that means is that both humans infect animal as well. So when you have animals infecting human beings, we say zoonosis. But when you have human beings infecting animals, we say there is what? Reverse zoonosis. And a good example of reverse zoonosis is what? Is tuberculosis, because it has been scientifically proven that human beings have infected animals with what? With tuberculosis. Other diseases like COVID-19, there are a lot of publications out there that scientifically confirm to us that human beings had infected animals like minks with COVID-19. So when we talk about zoonosis, I want us to put in our mind that it's not all about animals transmitting disease to humans, but humans also transmit disease to animals. Now, 80% of pathogens infecting animals are multi-hosts. What we mean by multi-host is that they can coexist between they can coexist between both animals and humans, meaning that they move among different animal hosts, including humans. And this has been documented in the World Health Organization report 2020. Now, what are the types of zoonosis? Having laid the foundation of zoonosis, we have 3 types of zoonosis. We have emerging zoonosis. And what we mean by emerging zoonosis are diseases that newly appear in a given population. And this population could be animals or humans. Again, some diseases might have existed previously, but are now rapidly increasing in incidence, or they are increasing the epidemiological coverage, like the geographical range. A good example of this kind of disease is what? Is HIV, COVID-19, Zika virus, rabbit hemorrhagic fever. For example, in Nigeria, rabbit hemorrhagic fever is an emerging disease in Nigeria because we first reported the disease in 2019. And again, some of these diseases, emerging diseases, have a lot they have a lot of economic burden. For example, the Ebola outbreak that happened in Liberia and Sierra Leone was estimated to cost over 2.8 billion US dollars. And likewise, Zika virus is estimated to have costs. This cost, it has to do with the response activities that were initiated to cope the outbreak and then the spread of the virus. It has cost over 912,000 US dollars. The next type of epidemiology of zoonosis is epidemic zoonosis. This occurs intermittently and are mostly domestic in origin. A good example of epidemic zoonosis is anthrax. Anthrax is a seasonal bacteria that affects mostly the domestic animals. There are different types of anthrax. We have the cutaneous anthrax, the respiratory anthrax, and then the digestive anthrax. So all these ones affect, and usually flood is one of the critical risk factors that initiate or increase the chance of anthrax outbreak. Because whenever there is a flood, the bacterium itself, it has a kind of, it's a spore-forming bacteria. That means it forms a hard shell around it, and that hard shell helps to keep the bacteria for a very long time until when it gets exposed to infect people. And the overall health burden of this kind of outbreaks is less than that of the neglected zoonosis. So when you talk of the third group of zoonotic diseases, we call them the neglected zoonotic diseases. And a good example of it is what? Is pig or tapeworm. This neglected zoonosis is mostly mostly in domestic animals, and it continuously presents itself in a certain population, because the pork eating population, and the risk factors is the cooking habit. When you have some of these meats that are not prepared well, so this particular worm could survive and then infect humans. The major issue with neglected zoonotic diseases is that there is less attention paid on them. And in most times, people really don't report tapeworm infections. So it's also always very difficult to control some of these diseases because the government and partners don't prioritize some of these diseases for eradication. Now, I try to put to us this timeline to tell us or to inform us on how the trends of zoonotic diseases that happen over time. Just looking at it from the year 2000 to 2020, just 20 years, we had over 14 outbreaks that had happened. We had dengue fever in 2000. We have SARS and West Nile outbreak in 2002. We had Marburg in 2004. And in 2005, we have chikungunya. In 2009, we have swine fever, down to 2019 when we had the almighty COVID-19. So one thing you need to understand here is that all these outbreaks are what? Are zoonotic. They originated from animals. So that is to tell you the risks that we are living with, because you cannot avoid these things. The best thing to do is to put in measures in place so that you will be able to control it. We don't pray for it, but there will be more zoonosis. There will be more outbreaks coming. So the best thing to do is to prepare ourselves, both in terms of manpower and technical ability to contain these outbreaks. In Nigeria, this is the current disease status of our country, Nigeria. As of today, we are successfully eradicated rinderpest. Since 1984, when we had the outbreak, we responded effectively and we've been able to eradicate the disease. Up to now, we have not received any report of rinderpest. But for reimagined diseases, we have had highly pathogenic avian influenza, monkeypox, Rift Valley fever, Lassa fever, and Ebola. And this is reimagined because, like highly pathogenic avian influenza, we had the first outbreak in 2006, and recurrent outbreak has been coming and going time after time. We also have an emerging disease. An emerging disease, we have rabbit hemorrhagic fever. Rabbit hemorrhagic fever was reported in 2019, and likewise equine influenza. We also have other diseases with increased prevalence. For example, contagious bovine pleuropneumonia, PPR, swine fever, foot and mouth diseases. The ecology and the epidemiology of these diseases has been changing over time. And one thing that stands unique among all these diseases is that the prevalence has always been on the increase. For canine rabies, we are beginning to see a new dimension. We are beginning to receive report from feline, that is cat. The last 2 years, we have received more than 10 reports, mostly in Bauchi and Adamawa, of cats coming down with rabies. For those of us that are still in practice, you will agree with me that the clinical presentation of canine distemper virus is changing. The report has it that we are beginning to see the disease manifesting different unique clinical presentations. Horse sickness is one disease that is coming up strongly, and we're really hoping that together we'll be able to do something to control it. Having come through this far, I would like us to go through some of the major anthropogenic drivers of zoonotic diseases. Of course, I try to pick the critical ones, the high risk factors to discuss, but we still have other risk factors that are either considered low or moderate in terms of risk assessment. For zoonotic disease, migratory birds have a very high risk in terms of spread, because some of these migratory birds serve as a reservoir host. A telemetric study was conducted 20 years ago, and these birds were captured, and a tracker was fixed on the bird and allowed to fly. 20 years later, this is the pattern. This was the movement of the bird represented here. And if you look at it closely, you will notice that the birds have traveled to 6 out of the 7 continents we have. And what this means to us as epidemiology is that, yes, the birds are free to travel or to move without visa, but supposing this bird is infected with a disease, what would you think would be the outcome? And what it means is that these birds must have spread infection across all the continent. The bird later died somewhere in Saudi Arabia. So what this means to us is that we can never be free. And you know, these migratory birds move at will. Some of their movements is seasonal, and there is practically nothing you can do. Instead, you put in preventive measures to control. But just to note that these are high risk factors when it comes to zoonosis. And this has been our battle here in Nigeria when it comes to highly pathogenic avian influenza. The next is interface, critical disease interface. We have 2 types of disease interface. We have livestock human disease interface, and then wildlife human disease interface. And these are I just put this picture to give us an illustration of some of the risks that is close to us. For example, if you go to some of the chicken slaughter slabs, these are some of the things you will see. And these are high risks. These are interface for what? For highly pathogenic avian influenza and also antimicrobial resistance. There could be other diseases that will follow this, that could that human beings could get infected through this pathway. Again, meat sellers. Look at this guy selling meat. If you look at him, he's not wearing anything. No hand gloves, no cover. In fact, he's not even wearing shirt. And this is a risk because of there's high chance of being infected with tuberculosis, IMR, brucellosis, and some of these zoonotic diseases. Again, if you come down, I put a picture of this Fulani guy that is rearing cattle. If you look at the cattle closely, you will see some nodular lesions on the cattle. And the contact these guys have with the cattle is so much that the chance of disease transmission is very high. We have seen report or received reports of Fulani rearers being infected with cutaneous anthrax. You see the lesions all over them. And this is a very high livestock human interface for disease transmission. Sometimes these chaps could feed from the same bowl or drink from the same water with the animals. And that is why we really need to create awareness to them to know that what they are doing or how to protect themselves from animals. They could also get infected through milking. This picture was taken to show how tuberculosis, brucellosis, and other diseases from animals could be transmitted to humans. So all these 4 pictures are representing livestock human disease interface. Now, if you look at the wildlife, like I said, We have migratory birds coming from different parts of the country. We have wetlands in Hadejia, and in Unguru, where birds come from different parts of the country seasonally, either for breeding or just for movement purposes. We also have these fruit bats. Fruit bat is because it's a very big issue for us. We have these colonies sometimes scattered within populations. Yes, we could have some of them, these nests, colonies resting within human population. Fruit bats serve as reservoir hosts as well as vectors for many microorganisms. In fact, 200 novel coronaviruses have been found in fruit bats. For example, Ebola, Nepal, rabies have all been isolated from these birds. SARS-CoV-1 and 2 have been isolated from these birds. Fruit bats also harbor 16 potential zoonotic viruses, and they also provide opportunities for recombination and reassortment of viruses. This is not to say that fruit bats are not important. They are important in insect control and pollination, but from the epidemiological angle, they also serve as mixing vessels for zoonotic diseases. Insects. We all know that the climate is changing and the weather is getting hot and hotter. So with increase in temperature comes another issue, and the problem is the fleas, the arthropods, the ticks, and the insects. They do well, or they thrive well under heat and temperature. And we know that warmer temperatures could also increase the incidence of diseases, both by increasing the vector population and distribution. For example, mosquito and other vectors that transmit viruses such as chikungunya virus, yellow fever virus, and West Nile viruses. Insects also transmit Chagas disease, and sandflies transmit leishmaniasis. Other vector-borne diseases are what? Rift Valley fever and dengue fever. So these are also critical high risk factors when it comes to zoonosis. Increase in trade and consumption of wildlife is another factor. In fact, more recently, the past 2 years, I've worked with the certification unit, and one of the things we've observed is that people are beginning to increase their test for pets. We're seeing people keeping lions as pets. We've seen people keeping different species of wildlife as pets. And again, with that demand comes trade. We have people now buying exotic breeds of dogs. Some are bringing exotic breeds or wild species of animals from different parts of the country. Another factor that comes with the trade also is the consumption. The consumption pattern or demand for protein is changing across the world. It could be because of the economic hardship, but right from time immemorial, we know that hunting has always been part of us as Africans. A study was conducted by Nasi et al., and he estimated that about 6 million metric tons of wildlife meat is harvested annually in South Africa, in Latin America, and Africa. So that is to tell you that wildlife or bushmeat consumption is a big industry. And with that, yes, it has its advantage, but from the epidemiological angle, is a risk for disease outbreak. Now, having talked about the high risks, the risk factors, how do we control it? That should be That is almost the purpose. That is the purpose for this presentation. There is a global strategy for the control of zoonotic disease, and this strategy is what? Is One Health. One Health is a global policy, and the Global Health Security Agenda that was signed in February 2014 recommended that all member countries to adopt One Health strategy. And Nigeria, being a signatory of the Global Health Security Agenda, signed and also adopted it. The vision of the Global Health, One Health Security, One Health approach is to build a nation of healthy people and healthy animals living in a balanced ecosystem. While the mission is to build a strategic, dynamic, and functional platform that advances human, animal, and environmental health through multidisciplinary and intersectoral collaboration. Out of the member countries, as at today, 60 countries globally have adopted One Health approach. And out of the 60 countries, 27 countries are from Africa. And in addition to the 27 countries, we have this list of countries that are in the pipeline. Like Cabo Verde will be launching their One Health approach in June. They had launched it in June. So we're having more countries adopting the One Health strategy, which is the only and the best option out of this quagmire, that is prevent the outbreak of, prevent the future pandemic. Now, just to look into One Health, and let's understand what we stand to benefit, or what are the strategies. We just looked at the strategy. How do we intend to prevent? What is the global strategy as contained in the One Health agenda to control future outbreak of zoonotic diseases? One is sensitization and awareness creation. And the idea of sensitization and awareness creation is to conduct advocacy to government at all levels. And when we go for advocacy to government, the talking point is for government to increase funding, and precisely the government to create a budget line for surveillance activities. In a number of states, let's say 10 states, as at our last count, 10 states had a budget line for surveillance out of the 36 states in Nigeria plus FCT. But it's one thing to have the budget line, it's another thing to have the monies released. So this is a challenge, and that is why we need to create awareness among the political leaders to create the budget line and also to release the funds so that surveillance activities will be able to be carried out. We also need to educate them on workforce. We are having challenges with staff strength across most of the countries in Nigeria. 15 states as at now have less than 20 vets on their payroll. In fact, in some states, we have only 3 vets. And that is where we need the government to employ, to recruit, to train workforce that would be able to implement some of our animal health surveillance activities. We are also reaching out to the government through advocacy visits to support the implementation of One Health. Yes, Nigeria is a signatory to One Health, but up to now, we've not been able to step down the concept, One Health concept, down to the community level. At the national level, we have the steering committee, the technical committees, and all the committees. And yes, at the national level, we're fine, but the challenge is that the subnational, the local government, and the community. So we need government to support the implementation of One Health down to the local government level. So advocacy to the government is one, because they are stakeholders in what? In disease surveillance. Another stakeholders in disease surveillance are the value chain operators. And what we mean by value chain operators, we mean all the live bird marketers, the livestock marketers, the transporters, the processors, and all the people that are working under the value chain. We need to sensitize and reach out to them, create awareness on the implementation of biosecurity measures. Biosecurity measure is critical to prevent, because it's a preventive measure that will reduce pathogens. And with good biosecurity measures, you may not need to treat. We also need to educate them on vaccination policy. Yes. For example, highly pathogenic avian influenza. As at now, the government policy is against vaccination of highly pathogenic avian influenza. So we need to encourage our farmers to stick to our policies. Also, during outbreaks, we need to educate our farmers on the need to obey movement restrictions, because one of the drivers of spreading diseases is movement restriction. When you have livestock and livestock products moving from one point to another during disease outbreak, then it makes it difficult for any surveillance or disease reporting officers to control disease. We also need to encourage our value chain operators to support the government in what? In disease reporting. One of the challenges we're having now in the control of avian influenza is that farmers are not reporting, probably because of compensation issues, but they are not really helping the situation. With or without compensation, you have an obligation to report disease outbreak. We also need to encourage farmers, educate them, create awareness on the need for withdrawal, observing withdrawal period. This is the only way we can control AMR, because a lot of the meats we have on the table in the market are products of microbial sick animals that have been treated with antimicrobials. So we need to encourage and then create awareness so that our farmers will adhere to withdrawal period as stated by the manufacturer. Another group of advocacy that we need to do strongly is also to reach out to the animal health workers. And what I mean here, we have both the private vets and also the para vets. The issue of disease reporting is one of the most critical issues that we are having. Most of our private vets and para vets are not reporting their activities or their diseases to the state and down to the national. And this is a big problem. We will have less than 10% of private establishments, private clinics that are reporting disease. And it will surprise you to know that even some veterinary teaching hospitals are not helping matters. So this is not good for us, and we cannot prevent future outbreak if we don't report disease to the relevant authorities. We also need to strengthen laboratory capacity, which is a very critical. And what we mean by strengthening the laboratory capacity is we need to strengthen them to perform genomic surveillance, that is molecular epidemiology. When we talk about epidemiology, it's not all about surveillance and everything. You can do surveillance in the lab, and you can do phylogenetic analysis to trace from where this pathogen is coming from, what is the linkage between this pathogen and the other, and that will inform decisions on control measures and other measures that need to be put in place. Our labs need to be equipped. In as much as we need more labs, we also need them to have capacity to do some of the basic laboratory tests that will help us confirm, because you have to confirm a disease first before you put in the preventive measures. So labs are very critical. We need also to establish national laboratory networking for both private and public labs. Yes, it's very critical. We have private lab and public lab. For example, we have labs like Zoonotic lab, animal care lab, concept vet lab. These are all private labs, but they are not networking with VOM, MVRI, which is our public lab. There is need for them, for these two labs to network. And this will help in sample referral and also organization of twinning program, so that we'll be able to build capacity within. In most of the public lab, because of government funding, they seem or tend to have more equipment and more manpower. So they should be able to train or conduct refresher training for some of the private labs to bring them on board when it comes to technical issues. We also need to incorporate all our laboratories into the early warning system. And what I mean the early warning system, I mean the surveillance system. We have the NADIS platform that we have developed. It's a digital platform. We need to incorporate them, all the labs, both the private and the public health lab, so that they will all be reporting disease to the national. And this will broaden the horizon of our decision makers and will help them to take better decisions when it comes to preventive measures. We need also to improve our laboratory turnaround time and search capacity. What we mean by laboratory turnaround time is how much time does it take a lab to process and give feedback in terms of results, because the earlier you confirm a disease, the better. I can give you an example. For example, avian influenza. If you fail to confirm or to detect the index case of avian influenza for more than 24 hours, your chances of controlling the disease is very slim. Yes. And you only need a lab to test these things, to do these laboratory techniques, confirm the result within a short period of time, so that other disease control measures will be put in place, such as depopulation, decontamination, and the rest. So turnaround time is critical in outbreak response. And also the search capacity, because sometimes outbreaks can be so overwhelming, and you need the labs also to be able to cope with the demands as it arises. Vaccine production has also been a very critical issue that we need to look into. Whether we like it or not, some of the zoonotic diseases are vaccine preventable. So we have to equip our lab to have the seed viruses saved in the gene bank in the labs, so that whenever there is an outbreak, in less than 24 to 48 hours, we could have vaccine to respond to the outbreaks. And until we build capacity in that direction, our chance of preventing future zoonotic will be limited. And the third point is to improve early warning system. Early warning system has to do with what? The surveillance. We have already developed or digitalized our national disease information system. And we have stepped it down. We have trained our surveillance officers in almost all the states. Of course, we have some little challenges that we're working on it. We're hoping that very soon we'll be able to put everything in place so that disease reporting will be done appropriately. And then for the early warning system, we need also to expand to cover for cross-border surveillance. Border surveillance is key, because some of the states are sharing borders, are sharing international borders. And anything happening across border could affect us inside as a country. So we need also to share information, to build network across our borders, to harmonize our disease response activities so that we'll be able to control this disease. Don't forget that some of these diseases are transboundary in nature. They don't know boundaries. They know no boundaries. So our approach should also follow same. The surveillance should also capture wildlife surveillance. This is one of the areas that my head of department is working on it to build a system that will be able to go beyond the domestic, the live bird market into the wild, because preventing these outbreaks from the wild is cheaper than controlling it when it happens in the population. So this is a very critical area that we need to look into together so that we'll be able to build a robust system that will prevent future outbreaks of zoonotic diseases. We also need to build our rapid response team and also the community animal health workers. This is for early detection. Rapid response team responds to outbreak on time, and they also what the community animal health workers help to pick disease events at the community level. For now, we have trained our rapid response team across all the 36 states plus FCT using the Redice Fund. For each state, we train the federal EPID officer, the state EPID officer, and then the disease reporting officer from the human health. That has been done, but again, we need to refresh our training. So there is need for the team to be refreshed continually and also be provided with input that needs, like PPE and other consumables that they will need to function when the need arises. As for community animal health workers, it's a work in progress. Some states, we have 10 states that already have their community animal health workers. Not across, it may not be across all the communities, but at least they have something that is like community animal health workers. So it's an area that the government needs to come in so that we'll be able to build that structure. And lastly, the interoperability of our NADIS, INIS, and SOMAS. The NADIS is a disease platform for the animal disease. The INS is for environmental surveillance. That is the staff under Ministry of Environment, while SOMAS is for human health. So there is need to match, to bring these two platforms together. Because One Health, as we said, is a multi-sectorial approach. And we cannot achieve multi-sectorial surveillance without communication between the two platforms. That will help improve our early warning system. So in conclusion, preventing future zoonotic pandemic in Nigeria requires a proactive and multifaceted approach that incorporates strengthened infectious disease surveillance, One Health approach, public education, and awareness. So by investing in these areas, Nigeria can reduce the risks of zoonotic disease outbreak and protect the health and well-being of its population. Thank you. These are my references, and I would also like to acknowledge my head of department, Chief Veterinary Officer, and in the person of Dr. Samuel Anzaku, who has supported and gave me the approval to make this presentation. And also want to acknowledge Dr. Meroka Chala, who has been supportive all through, and also the leadership of Konekt. Thank you.
Thank you so much, Dr. Ayuba, for the wonderful, detailed, and insightful presentation. Thank you so much. We have learned a whole lot tonight. Let's celebrate our speaker tonight in the chat box. You can drop clap emoji, anything you feel like celebrating him. I believe we all have learned a lot this evening. So to every participant, we have shared an attendance form in the chat box. Do well to fill the attendance form before we close, so that you can have access to the presentation slides. So we're going to go over to taking questions now. So for everyone who has questions, you can type in the comment sections or you can raise your hand and we'll give you the room to ask your questions. So for those who joined lately, we are discussing preventing future zoonotic pandemics, and our speaker has been Dr. Ayuba Sini, a public health officer with the Department of Public Health and Epidemiology to the Federal Ministry of Livestock Development. And he has walked us through on zoonosis, and he has highlighted the fact that Africa is a potential hotspot for zoonotic diseases, and this is due to the high wildlife biodiversity, the rapid population growth, and recurrent outbreaks. And then he has walked us through the types of zoonotic diseases, from emerging to epidemic to neglected zoonotic diseases. And he also noted that in the last 20 years, we've had we have 20 zoonotic outbreaks. He has also stated some of the major anthropogenic drivers of zoonotic diseases, which migratory birds species are part of, and others. And importantly, he has highlighted that the One Health approach is very critical in controlling, preventing zoonotic diseases. So we all are encouraged in this webinar to create awareness at our various ends. There is also need to strengthen laboratory capacity, and there is also need for early warning systems, strengthening early warning systems. Thank you so much, Dr. Ayuba, for the wonderful presentation. So we're going to open the room for questions now. So if you have a question, you can raise your hand or you can type in the chat box. I haven't seen any hand up yet. Okay, so if you are yet to take attendance, the link is shared so that you can have access to the presentation slide. It's such a very detailed presentation. Thank you so much, Dr. Ayuba, for the wonderful presentation. Okay, we have Maureen Rumon. So Maureen, you can unmute yourself and ask your question. Thank you very much.
All right, as I was saying, Dr. Sini, once again, thank you very much for the good and informative. I want to add to what you discussed. The issue of getting to the wider audience or the wider population in Nigeria, we all agree that media can do a lot. So in all this, you have talked about prevention and control. I don't know where is the position of the media in assisting to get in the prevention and control. Thank you.
Thank you, Madam Morin. If I get you right, you asked where is the position of the media, right? In awareness creation. Yes, the media, public awareness is very critical. In fact, the media could come in form of print media, or it would come in form of community sensitization group. For example, we have partnered with some organizations during outbreaks to create awareness. Where in last 2021, we used print media to create awareness on rabies outbreak in Plateau State, Benue, Bayelsa, Gombe, and is it Adamawa also, where we had outbreaks of feline cats coming down with rabies. We produced jingles, and these jingles was what we using the radio stations to air it, and then we're able to create a lot of awareness. It will interest you to know that in public health, you really cannot conduct any outbreak investigation without creating awareness, because you need the people to give you information. You need the people also to support whatever you are doing. That is the whole idea of One Health. Nobody is considered as a nobody. Let me use that word. We all need all hands on deck, and you cannot get attention or support of people without media. And that's why the first point I raised was sensitization and awareness creation. There are a lot of things happening in our wildlife and the live bird markets. If you go to most of our live bird markets today, one of the critical challenges we have is implementation of biosecurity measures. And from the pictures I shared, you could see that. But in Jos, Yankaji live bird market, we tried something. We reached out to them, we trained them, and then we gave them some input. That was in 2002. The response was very fantastic. As I speak with you now, these same people observe every month, at least one day. They take one day, they will stop selling their birds and then do some kind of sanitation and disinfection. And how did we achieve that? It's through media and through communication. So the role of awareness creation can never be overemphasized when it comes to public health issues. And the more you create awareness, the less the burden for you. Most of the challenges you are having many times is not because the people are not willing to be supportive, but in sometimes they are just not aware of how risky some of their behaviors are to their health. I recall in 2017, we went for polio outbreak investigation, and I met a Fulani man somewhere in Ashaka, in Gombe. I had a close interaction with him. He had dogs, he had 2 dogs that were not vaccinated. And when I educated him on rabies, surprisingly, the Fulani man traveled with those 2 dogs from Ashaka to Gombe Metropolis to get his dogs vaccinated. So you see what awareness could do. But ordinarily, one would think that these people don't want to get their dogs vaccinated. But the real truth is that it's just because the awareness is not there. So the role of media or awareness creation in public health outbreak response or preventing disease outbreak cannot be overemphasized. However, I will still give the room to my colleagues if they have something to add. Thank you.
Thank you very much, Dr. Ayuba, for that response. We'll move next to, I believe the question is clearly answered. So we'll move next to Moses Eki. Moses, you can answer, you can unmute yourself and ask your question. Thank you.
Okay, yeah, good evening, everyone. My name is Eki Moses, as rightly stated. Actually, nice presentation, Dr. Sini. I just have a concern and also, let's say, a comment. Considering the fact that at the federal level now, there's a ministry which is Ministry of Livestock Development, which is being saddled with responsibility of veterinary services now. So my question is, I understand that there are some states that are still, the veterinary service is still under the Ministry of Agri. So how can the federal streamline or hold those states now to be able to create a separate ministry so that the issue of the One Health will be, achieve a lot? And then also, I want to know, apart from these major diseases that zoonotic diseases that you've talked about, I don't know if maybe there are rooms for a reimagine or emerging zoonotic diseases in the future. I think you could just share a brief for us so that we're able to know, okay, yes, we have some of those things that are not really now of concern.
Thank you, Dr. Moses. I think
Sign now,
get
but
the
we should also look at for in the future. Thank you very much.
okay. Please let me get the second question. I beg your pardon for the second question, please.
Okay, I said, can you share more light on some of those diseases that we are not, because I understand Lassa Fever, rabies, are there other zoonotic diseases that might not really be of concern now, but we should worry about maybe in future, like reimagine or emerging zoonotic? That's my question. Thank you, sir.
Okay. So, thank you. The first question you said is about the livestock ministry, right? So, the livestock ministry is one of the major achievements of this present administration of His Excellency Governor and President Bola Ahmed Tinubu. When he created the Federal Ministry of Livestock Development in June, July last year. The ministry is 1 year plus, and just after when the declaration was made, as we speak, 10 more states have already created State Ministry of Livestock. But you know, the Constitution of the Federal Republic of Nigeria has given states power. They have their own power, what we call the exclusive. Some items on the constitutions are on the exclusive list. So the government cannot determine or influence the states to do to create ministry on their own. But the best the ministry can do is advocacy visit, and which the present PAMSEC, my PAMSEC, Dr. Chinyere Akijobi, has done a lot on that. And that is why we have 10 to 11 states with State Ministry of Livestock. The advocacy to the state government is still going on, and we're hopeful that more states will join. And the more of these states we have on board, the more our capacity to implement some of our livestock disease-related activities. Because you need a command structure that will support whatever activities you are doing. We are aware of some of the interministerial bureaucracy. When you have vets speaking to vets from the same or from the national to the subnational directly, chances are that we can be able to do a lot. And this step, this creation of livestock ministry, is a major achievement, because this will increase funding to the livestock sector, and again create more opportunities to our vets, because We are hopeful that with this creation of ministry, there will be more recruitment, and again, it is going to step down to the state. We are not only going to stop at the state level; it will go down to the local government level, because we need to have vets even at the local government level, where some of the activities are happening. Don't forget, any outbreak happens in a local government or in a community. So when we are talking of national, subnational, it's just a geographical description. Yes, it's just a geographical description. Any piece of land today is under an authority, either a community or a local government. And we need to go down to the lowest level, so that we'll be able to dictate early, and then we'll be able to implement our activities early. So we are hopeful that more advocacy will be done to the state governors, and then we'll, going forward, see more states creating a state ministry of livestock. Then, about other zoonotic diseases that we need to watch out for. There are lots of zoonotic diseases, zoonosis, that are outbreaks that is happening across the globe. For example, there are reports of Marburg disease outbreaks. Middle East respiratory disease is also one disease that we need to watch out for. Rift Valley fever is not too much of a challenge for us around here, because the risk factors are not that prominent. But on the global scale, there are a lot of outbreaks that, as a country, we need to prepare and be equipped should in case there's an outbreak. Thank you.
Thank you very much, Dr. Ayuba, for those insightful responses. So we have one more question, this time in the chat box, and this is coming from Dr. Beatrice Asina Mai. So he says, great presentation, Doc. As a follow-up to Madam Maureen's question, apart from the media, what other stakeholders should be part of the One Health framework but are currently not engaged?
Okay, thank you, Dr. Asinama. The One Health concept is a multi-sectoral and multidisciplinary approach. The ministries of health, environment, and agri are the key primary stakeholders. We have secondary stakeholders and down to tertiary stakeholders. It will interest you to know that even the security personnel are also part of the multi-sectoral approach. At the national level, National Technical Committee, Steering Committee, we have the Office of the Security Advisor. And I remember in just 2005, when we had the outbreak of highly pathogenic avian influenza, we used the police, because where there were the population site where we used to depopulate the birds, we found out that some people are going there to exhume the birds. So we ended up using the policemen. The local government, the religious and traditional leaders are also stakeholders of the multi-sectorial approach, because they help to reach out to the masses, to their communities, whether in churches, other traditional, they reach out to their communities for us to get acceptance. We also have the media is there, the leadership of the livestock value chain leadership, like the poultry association, the pig associations, all the value chain associations are also critical stakeholders in the One Health structure. So the list goes on and on, but this is what I can say for now. Thank you.
All right, thank you very much for the response. So this will be our last question for tonight, and this is from Dr. Jarumi Barnabas. So over to you.
Okay, good evening, everyone. Thank you to VetConnect, and then Dr. Ayuba. It's nice sitting and also hearing from you once again. So, sir, I have a worry, like you said, on issue of avian influenza. There are still farms that are still vaccinating against avian influenza. And then the second thing is, I don't know, are there any efforts put in place, more especially the new ministry that is in place, to see how veterinarians can be employed? I wouldn't want to mention a certain local government in my state. I think about 3 local governments to 1 vet, and it has not really been a good thing. There are a lot of vets today. Veterinarians are being, we're getting close to 13, 14,000 in Nigeria. And some of us are so passionate about some of these things. And we want to also give back to the community. So I don't know, is the ministry trying to see how states can, because there's a lot of bureaucracy in the state employing, and it's just from one story to the other. So that's just my concern.
Yes, like I said, the states have their own powers constitutionally. The federal cannot impose on the state to recruit, but advocacy visit to governors and the leadership of the state will help. We really have to reach out, like I said, in terms of workforce, on workforce issue. We really have to work on our advocacy, to reach out to the states, because the issue of staff attrition at the state level is becoming a serious issue. And some of the governors are now actually willing to recruit. And if you look at the recruitment issue, it's not only limited to vets. It cuts across. Some states have not recruited for the past 10 years. But that is not a justification for it. All what we need to do is to play the politics. Now, for example, that campaigns are coming. The veterinary associations at the state level should key into whatever that is happening in the states. Identify a potential winner and strike a court ideally. These are some of the ways that, as a vet, we are not trained to be politicians, but we have to key to what is happening. We have to be part of what is happening at the state level. Because if you look at the cycle today, it's all about reaching out. You will have to convince the leadership of your state of the need that they need to recruit. I know some few states that really play the DVSs did a lot to see that the states recruit, and they are getting results. They are liaising with the government in terms of election, during the election, and helping the government, the incoming governors or potential governors, to see reasons why recruitment needs to be done and the issues of vets needs to be attended. So recruitment is not something that one can direct or write a paper and tell the governor to recruit. It's something that you have to lobby. Let me use the word. You have to lobby, and not at individual level, but as association level. And you also need to show, to demonstrate, and to show the government that they need you as a vet to implement some of the public health issues. Now that the One Health concept is coming out strongly, this is an angle that we vets need to take advantage of. Of course, because when there is outbreaks, it's a joint thing. And when we move jointly, our strength increases. So we should look at better options, how to reach out to the governors, because they have their exclusive right to recruit or not to recruit. No federal structure or leadership will impose on the state to recruit. So at our own level, at the state level, we need to do our own politicking and lobbying to see that whenever there is recruitment, vets are given a very good chance to be recruited. Thank you. But again, it's open to other contributions. If any of our participants here have something to share with us, I would gladly learn from such kind of person. Thank you.
Okay, thank you very much, sir. So we'll just give 2 or 3 minutes at most for any other contribution. If you want to contribute, you can raise your hand. 1 minute each, most at most, and we'll take just 3 persons. Yeah, we want to wrap up exactly by 9:30 p.m. So the room is open. If you want to make further contribution, you have just a minute. You can raise your hand and we'll give you that opportunity. Meanwhile, there is a notice in the chat box. Someone that asks concerning employment of veterinary doctors, please tell the person to submit his application to Nigeria Agricultural Quarantine Service, Abuja, so that whenever they are employing, they might consider his application. So the person that asks that question should please take notes. So the room is open, just very, very few minutes. Okay, thank you very much. We have Dr. Samuel Anzaku. Yes, sir. Over to you, sir. Dr. Samuel Anzaku.
Good evening, colleagues.
Good evening, sir.
Let me recognize my teacher. I can see Professor Kwaga is also part of this house this evening, and other esteemed colleagues. First of all, let me congratulate my colleague, Dr. Sini, for the very, very deep and insightful presentation. I wouldn't want to make any. I just want to make 1 or 2 interventions regarding some of the questions that arose. Some talked about the issue of the ministries. Maybe for the record, I think we need to just, so far, as at the last count, we have about 19 states that have created a livestock ministry. And just like Cindy said, it is actually work in progress. There's a lot of advocacy that is ongoing by our minister and other members of management of the ministry. And like we also know too that livestock and agriculture are on the concurrent list. And what it means is that all the different tiers of government have their level of control. So there's no imposition. You can only talk about collaboration. So the minister has repeatedly said it, that he will continue to advocate and speak with the different governors on the need to have these different ministries. I'm sure I'm aware some states have even gone ahead to create commissions. I think one is, Benue State, and even Borno, if I remember very well. So just to tell you that I think it is work in progress, and we'll continue to do the necessary advocacy to ensure that the potentials of the new ministry is realized even at the subnationals. But the senior has already talked about a lot on the issue of One Health and zoonosis, but just like an addition to actually strengthen the issue of the global health security agenda. I'm sure some of you are aware there was what we call the NAFS 1.0 National Action Plan for Health Security. It's a global document, and Nigeria reviewed it recently. It has different pillars, different diseases, different chemical events with action plans. And the idea of having that document is to actually streamline and put it side by side or capture in our own national budgets as we pursue our various mandates as different ministries. So just to add my voice that the NAFS 2.0 is a document that was actually developed by the 3 line ministries and other stakeholders. Now, I heard about the issue of employment. Again, I think Dr. Sina has already captured it. You will know that we cannot, as a ministry, impose some of those things on, we can only do advocacy. And that is why I must commend the national leadership of the NVMA. They've been doing a lot of advocacy, and you know, they are the pressure group. So I will only continue to say that it can only get better. But as a ministry, we've been trying to develop the sanitary mandate program, where you're talking about public-private partnership in animal health service delivery. It's a concept that is being developed, because it is something that is working in so many places. You can use it for meat inspection. You can use it for treatment, surveillance, and so many other things. And it's going to be a win-win situation, so that you can still be rendering some of the service, and there are some incentives that you get, even as private practitioners, and the government providing all the enabling environment. So there are a lot of things that are actually happening. But just to really assure all of us that the ministry is really committed to bringing in some innovations. He mentioned about the NADIS, National Information and Surveillance. It is something, and we're also trying to even link up with other private sector platforms that will leverage on the issue of technology to do a lot of the things we're doing already. So zoonosis, like I said, it's a big problem. I'm sure you're also aware that just last week, Tuesday, Nigeria, we had there was a joint press release by the Ministers of Agriculture, Ministers of Health, Livestock and Environment on the upcoming ministerial conference on AMR, antimicrobial resistance, in June next year, 2026. And Nigeria is going to host it. So this is also an information. It's going to be the 5th meeting. The last one was held in Saudi Arabia. So, but like I said, as a ministry, we continue to keep our colleagues, both in and out of government cycle, informed of these developments as we work together to strengthen the animal health sector, the issue of zoonotic disease control, AMR, and the likes, food safety. So I think it's a call to action to all of us. I want to say I'm really particularly happy for the initiative that VetConnect did this. I think it's a very good platform that we have been able to exchange ideas and information. And just to assure you once again that we're ready to collaborate with all our private sector people in ensuring that we make a difference in the livestock industry of this country. So let me stop here so that I don't take the whole time giving a lecture again. Senior has done a very tremendous, good job. Yeah, so I think I thank you once again for participating. Thank you very much.
Thank you so much, Dr. Samuel Anzaku, for that insightful contribution. Thank you so much. And thank you, everyone. Because of time, we may not be able to take further contributions. We want to sincerely appreciate everyone that has joined this meeting. We are particularly grateful to our speaker, Dr. Ibrahim Ayuba Sini, for the wonderful and insightful presentation. Want to acknowledge everyone. Because of time, we are unable to acknowledge everyone that has joined. Thank you so much. We see the NBMA National Secretary, Dr. Samson Agbese, is on the call, and many, many others that we are unable to mention. We have Dr. Tese Orum from the National Center for Disease Control, and many, many others. We want to appreciate everyone that has joined tonight's call. And beyond this, we organize monthly webinars that are aimed at bringing together animal health professionals to see how we chart a path towards improving animal care in Africa. Thank you so much for joining, and for everyone that has joined and taken attendance. We hope that we share the presentation slides to you in due course. Thank you so much. And I don't know, Dr. Ibrahim, I don't know if you have any closing thoughts before we end the call.
Yes, thank you all for participating. I want to close with a word that says a threat anywhere is a threat everywhere. So let's join hands to prevent future zoonotic outbreaks. Thank you.
Thank you very much. And thank you everyone for joining. Do well to follow us, Vet Konekt, on all our social media platforms. On that note, we'd like to call it a day. Thank you so much.
Thank you.